Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Neuroleptic malignant syndrome. So first we are breaking it down into certain headings. So we begin with the signs and the symptoms. So signs and symptoms, first is the presence of fever. So fever is present and this is greater than 40 degrees Celsius, and then there is also the mental status change, MS change is present. Then there are also some motor symptoms, the motor functions, the motor symptoms. So this includes the muscular rigidity. So there is muscular rigidity is present. So this is generalized, and then there is presence of dystonia. There is presence of the dystonia as well as the akinesia. So dystonia as well as the akinesia. Next is the autonomic symptoms. So there is autonomic. So here in autonomic symptoms, it can include the presence of tachycardia, arrhythmias. So there can be tachycardias as well as the arrhythmias. Next is there can be liable blood pressure, tachypnea, and the diaphoresis. So there is liable blood pressure, there is tachypnea as well as the diaphoresis. Then what we have is there is mutism also. There is presence of mutism. There is obtundation as well as there can be presence of the agitation. There is mutism, obtundation as well as agitation. Now let's move on to the precipitating factors. So here in precipitating factors, there can be antipsychotics. So antipsychotics, it can be typical as well as atypical. So it may be typical as well as atypical. And also the precipitating factors, it includes the presence of the antiemetics. So antiemetics, it can be due to the promethazine. There is promethazine as well as the metoclopramide. So this prochromazine as well as metoclopramide. Then withdrawal of anti-Parkinson drugs. Then comes the withdrawal. So you do a withdrawal, and this is of the anti-Parkinson drugs. So that is nothing but the dopamine agonist. Next is we have the presence of the infection as well as the surgery. They are all precipitating factors, that is infection as well as the involvement of surgery. Now let's look at what is present in investigations. So in investigation, there is elevation of the WBC count. So increase in WBC, then the CPK is also present. CPK, then comes the myoglobin as well as liver enzymes. So CPK, myoglobin as well as the liver enzymes. Next is there is myoglobinuria. It may be seen in patients who develop acute renal failure. Then comes the myoglobinuria. So this may be seen in patients who develop acute renal failure. So this is seen in patients of ERS, that is acute renal failure. So this was the investigation. Next is we look at the treatment. So how is the treatment? So treatment, if you see, it is to stop the neuroleptic agents. So first is you stop the neuroleptic. So you stop the neuroleptic agents and you start a dopaminergic agonist, and then you start the dopaminergic agonist. So you start a dopaminergic agonist. Then what you do is supportive care is given. The support care, and this includes a hydration. So there's hydration as well as a cooling. Then comes the dantrolene and the bromocriptine. There is presence of dantrolene as well as the bromocriptine. Then is the amantadine. It may be used in some cases. Presence of amantadine. So it may be used in some cases, as well as there is presence of the ECT. The ECT therapy can also be used. learn and grow daily like this, please do subscribe.